Yes, oh yes, this Honorable County Commission meeting is now open pursuant to adjournment. The Honorable Jesse Wallace is now present and presiding. All you having business before this Honorable Commission, come forward and you shall be heard. God bless the great state, county, and nation. Mr. Wagner will lead us in prayer.
Shall we bow? Heavenly Father, we give you thanks for this day. We ask that now that you be with us as we come to this time of meeting, give us wisdom to do the work set before us and grant peace to every heart. We ask for your continued blessings upon this great state and nation, and then we ask that you extend your strong hands of protection around our armed forces, wherever they may be. And all these things we ask in your name. Amen.
Amen. Amen.
Mr. Wallace will now lead us in the pledge of allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Ms. Etheridge, at your convenience.
Mr. Coleman.
Here.
Mr. Daniel.
Here, ma'am.
Mr. Dredden.
Here.
Mr. Graham.
Here.
Mr. Howell.
Here.
Ms. Hampton. Here. Mr. Hooper.
Here.
Mr. Hughes.
Here.
Mr. Hunt.
Here.
Mr. Hart.
Here.
Mr. Mayberry.
Here.
Mr. Rochelle.
Here.
Ms. Spencer. Here. Mr. Wagner.
Here.
Quorum has been met.
Thank you, Ms. Etheridge. Next item, consideration and approval of minutes from our previous meeting. I have those before you. Give you a moment to look them over, or I'll entertain a motion.
I move to approve.
Ms. Spencer,
Second.
second Ms. Hampton. Discussion? All in favor say aye. Aye. Opposed? Motion carries. Next item, citizens petition and grievance. Anyone in the audience like to address the commission? Ms. Davis, please step forward and identify yourself for the record.
Hi, I'm Karen Davis, Tourism Director for the county. I just wanted to take a few minutes this evening to introduce you to our new Executive Director for the Chamber of Commerce. I'm very excited about having Daryl Mosley here with us. He is a Humphreys County person, lifelong resident. He lives in McEwen now. He's owned his own businesses. I think he's going to be an astounding person at the Chamber and really move us forward. Daryl, would you like to come up and say a couple words to the Commission? Daryl Mosley.
I wasn't prepared to come in and see so many people that I knew, but because I've been gone a long time, working in Nashville. I've lived in the county for a long time, but it's a joy to see so many people that I do recognize, and glad to know that you're doing such great work for the county, and I'm glad to be a part of it. Thank you.
Thank you, Mr. Mosley. Anyone else? Ladies? Identify yourself for the record, Ms. Warren. There you go.
Okay, I'm Minnie Lou Warren. I volunteer at the animal shelter and work for the Humane Society. And don't get excited, we're not here asking for money tonight, believe it or not. If you got any loose change laying around, we'll take it off your hand. But we were here last year and y'all got back on board, and there's been some great progress made up the shelter. It's back then a teamwork. And thanks to Ann Hunter and the girls at the shelter, there are lots of good things going on. And Ann, well, she's more up to par on what's going on, so she's going to give you an update. We promised you we'd try to keep you informed a little better than we have in the past. Thank all of you again.
Thank you, Minnie Lou.
Oh, and Chris, thanks for going up and doing the weeds for us.
It will help reduce the number of ticks. I'm Ann Hunter. I'm the president of the Humphreys County Humane Society, and one day maybe I can introduce myself and not following the great leader that Minnie Lou has been over the past couple of years when I took over. And I know that all of you read the newspaper, and you know that I have an article in the paper about every 2 weeks. I have thanked you in that article, but I want to thank you in person. Well, look in your face and thank you very much for supporting the Waverly Animal Shelter, because it has made a world of difference. It has helped motivate us, and we have done some really great things, and I want to take a few minutes and share with you. Two of the things that the Humane Society tries to focus on is reducing the intake, the number of dogs and cats that come into the shelter, and then increasing the adoptions. And the reason we want to do both of those is so we don't have to euthanize dogs and cats. And I can tell you, with all the programs that we now have in place, we have euthanized 10 dogs this fiscal year. Last year we euthanized over 300. So 10 dogs, and not one of them was because of overcrowding. All of them were for dogs that were sick, they had no quality of life. It was the right thing to do, and only one of them was an aggressive dog. So I'm so excited about that. I'm also excited about cats, because last year we euthanized 50% of the cats that came in. We're at about 30% now. So cats are a little bit more of a challenge, and I'll share with you some of the things that we've done with those. But one of the greatest things that we've done is partner with PetSmart charities. If you go to PetSmart stores, they'll ask you, do you want to donate another dollar, a penny, or a nickel, or whatever. All of that goes to a program called Rescue Wagon. Rescue Wagon partners with rural communities like us. There's about 8 shelters in the state of Tennessee that work with them, shelters and humane societies. And they agree to take our dogs, our healthy, non-aggressive dogs up north, because they are crying for dogs. Can you believe it? They don't have dogs to adopt to everybody that wants one. And the reason they don't is because they have rules in their state that no dog can be in Wisconsin, Illinois, Indiana, Minnesota. No dog can be there unspayed or unneutered unless they are purebreds that come from a certified breeder. So a puppy in those states costs about $2,000. So they look to the south, because we got lots of them. So we take our puppies and we take our dogs and we ship them, we transport them on their little rescue wagon up north. And since we started this in November, we have transported 168 dogs out of this county up north. And they not only take our dogs, they also give us money. So we've made $5,500. They paid for our medical expenses. So it's a win-win. You can't go wrong with Rescue Wagon. So there's a lot of work that goes on. The ladies at the animal shelter, the Humane Society, every 2 weeks. We got to go again. We got to assess dogs, make sure their shots are there, take their pictures, all of those things. There's a very structured approach to it. It keeps us very busy, but it's well worth it, and it's a good program. We hope to continue it, and then we'll continue it with us until we reach a point where we don't have a problem with too many dogs. So we're excited about that. On the cat side, we have done some good things with them too. Believe it or not, PetSmart Charities gave the Humane Society, ready for this, $40,000 to spay free roaming cats in this county. We have spayed and neutered 575 of those little critters. And the only restriction is the people that have all these cats running around out there, they've got to be willing to continue to feed them. So we'll help them trap them. We bring them in, we get them fixed, we put them right back out again. They don't have to worry about having kittens in their barns anymore. So 575 cats. That is the reason we don't have as many cats in the shelter as we did last year. We still have lots of kittens. Anybody want any kittens? Come on by. We've got plenty of them. Also got a few puppies too. So that has been one of our bigger grants. We had a $10,000 grant from ASPCA and $2,000 from the state of Tennessee. If you buy one of those license plates that says you're pet friendly, the state of Tennessee gives humane societies a certain amount of money each year for spay and neuter. So over the last year, we've gotten $2,000. So we will spay and neuter, and we've actually based that on income. We've actually done free spay and neuters for anybody that makes $20,000 or less a year, because it's kind of tough. Everybody owns a pet. They can't always pay to get them fixed. So we've been able to take care of about 250 dogs and cats through the owned program. We also have a wonderful grant with Build-A-Bear. Believe it or not, there's a lot of grants out there to help people take care of their dogs and cats. And I spend probably an hour, maybe 5 hours a week searching the internet looking for ways that I can bring money into the county and not have to ask anybody for it here. And Build-A-Bear, I put in an application for them, and Build-A-Bear said, okay, we'll give you this money, and it is for senior citizens to adopt senior pets. We've actually adopted 5 so far. The senior citizens, they need pets, but they don't want a pet to, a puppy jumping around and all this. They want a nice, mature, dog or cat that's already calmed down. So we've been able to do that, and we have money to adopt about 10 more. So senior citizens, senior dogs, senior cats, we have a program to help them as well. Now, we had a great fundraiser this year with Paws in the Park, and this community overwhelmed us. We sent out letters to businesses, and we asked them to donate money for Paws in the Park. Now, what Paws in the Park is, it's a fun day for dogs, but more importantly, it is a program to make money to pay our medical expenses. 85% of all of our money goes to pay for medical bills. Broken legs, heartworms, just all of those kinds, shot in the ear with an arrow, all those kinds of things we pay for through the Humane Society. We made $5,000 from the businesses this year. Businesses donated sponsorships for $5,000. I was overwhelmed. So that is the biggest fundraiser that we have had, and we thank this community for that. Now, I got one more thing I want to add, and then I'll get out of your hair. On the 20th and 21st, and the following weekend, I think it's the 26th and 27th and 28th, we're having our annual yard sale. It is going to be at the building across from the elementary school, and Mr. James Hedge from Superior Builders is donating the use of the building. He's not charging us anything at all, and his comment was, because I want to support my community. So we're excited about not having to pay rent. So if you've got anything in your attic that you want to get rid of, that you want to bring on down to that building, read the paper on Friday. I'll tell you when you can drop it off, and better yet, come on down and spend a little money at the yard sale during the month of June. Thank you very much.
For that report and the good news concerning the animals in the community.
I'm sure they're pleased and quit euthanizing so many of them.
Next item, fiscal review budget personnel committee report. Mr. Hughes.
The fiscal review and budget meeting was held on June the 2nd at 4:30. There were 6 members present. After the approval of the May minutes, the next item was the financial report for the month of April. After that was looked at and talked about, that was also voted on. The first resolution we had was the resolution to appropriate $15,000 for airport fuel purchase to cover the remainder of this fiscal year. After a motion and a second, this was discussed and voted on to send to the full commission. The next resolution was to present to reappoint to the County Library Board. And that was voted on to send to the full commission. The next resolution was to reappoint Nelda Durham to the Regional Library Board. That was voted on to send to the full commission. The next resolution is in support of the renaming of State Route 1 in honor of our fallen heroes and families. This is what we call Highway 70. And after discussion and explanation, this was voted on to send to the full commission. The next resolution was to authorize the county executive to negotiate and enter into a lease agreement for the land use for this convenience center at the Buffalo Convenience Center. After explanation, discussion, this was voted on to send to the full commission. The next resolution was to, for Mr. Wallace, presented the cost to the county for the purchase of emergency radios to comply with federal mandates. The radios would be purchased as a whole for the county through the 3 city by the Emergency Communication Board. After explanation, discussion, this was voted on to send to the full commission. The next item was employee health coverage. Mr. Wallace presented the bids for employee health coverage. The low bid was financial blueprints, and no action was taken pending the further investigation of feasibility by Mr. Wallace. The next item was the school board budget. Mr. Long presented the 2014-2015 school budget for review. There was no increase or no request for increase, and we adjourned at 5:05.
Commissioners, you heard the report from Mr. Hughes. Any questions for him or his committee? Hearing none, move on to Public Works and Safety. Mr. Rochelle.
Public Works and Safety met on May 19th. at 4:30 with all members present. The approval of the minutes from April 28th went down as okay. Next item on the agenda was the Highway Department bids. Mr. Woods presented bids for the upcoming supply needs for the Highway Department. After discussion, this motion was approved to send to full commission. Same on the Convenience Center. Mr. Wallace informed the committee that the owners of the property hosting this center had requested a change in the lease, including an annual payment of $1,800. Mr. Dennis Jones. After discussion, that motion was approved to send to the full commission. Next item on the agenda was the radio purchases. Mr. Wallace advised the committee that the County Emergency Communication Board was considering a measure to purchase all of the county radio equipment necessary to comply with federal guidelines. The county would be responsible for repayment by increasing the operation cost share. After motion was made and discussion, it was approved to send to the full commission. The next item was American Gold Star Mothers. Mark Morrell spoke to the committee regarding a request for support in renaming and erecting signage designating State Route 1 as Gold Star Families Memorial Highway, which, as Mr. Hughes said, is Highway 70. After discussion, the motion was approved to send to the full commission. Our adjournment was at 5:27.
Commissioners, you heard from Mr. Rochelle. Any questions for him or his committee? Excuse me. Next, then, moving on to report and communication from the county executive. Commissioners, for the purpose of discussion of some time-sensitive action items, without objections, I'm going to declare that by unanimous consent that we dissolve the meeting into a committee of the whole for the purpose of discussing the health insurance and another item or two. Any objection? Very good. Employee health insurance is reported by Mr. Hughes. At last week's budget meeting, the committee reviewed tabulation of responses from our RFP distributed to potential providers of health, life, and dental insurance. After review of the tabulated responses, there was one offering that the committee felt strongly enough about to ask me to provide some additional information, and to that end, I asked Mr. Tim Herndon, representing Financial Blueprints, to come to this meeting and make himself available to answer questions. In addition to providing questions and answers to you, the committee, and those responsible for making ultimately the decision on whether to switch from the state plan that we now have, I also invited all the department heads, as this directly impacts our employees, and we want to do what's best for them. So with that, I'll ask Mr. Herndon to step forward, identify himself for the record, and give us a brief overview of.
Hello.
Yeah.
Sure, it's on. Thank you, Executive Wallace and County Commissioners, for allowing me to present this information and the opportunity to bid on your business. First thing I want to do is I got some handouts, well, I guess let me back up before I get to that. As Executive Wallace said, my name is Tim Herndon, and my company is called Financial Blueprint. I'm an insurance and financial advisor, and have been in business for I think 26 years now. I'd like to say I started when I was 12, but unfortunately it's a little bit later than that. So what I did was we put together a proposal, and I wanted to take this opportunity to initially start out kind of up above in a big picture kind of a way, and I've got some handouts for you, and then drill down to as specific as you guys want to get. All right, so let me do my handouts. Didn't have enough initially, so I had to make some copies. So I'm going to go color and then non-color, black and white. All right. I'll tell you what. This is when I need my assistant. I think just talk to my brother.
Yeah, I did. Just came down.
My brother lives here in, hopefully nobody will hold that against me, okay? But my brother is the Farm Bureau manager here in town. So, yeah, you get a black and white one.
I'm colorblind anyway.
You go.
Your brother?
What's that?
Your brother?
Yeah,
I won't hold it against you.
please don't.
It's either the same, just one's colored, one's black.
Yeah, it's the same exact thing, actually. All right, now the ones that have a staple, it's just the way that they were copied and they were automatically stapled together, so they're not in the order I'm going to go in. So I'm going to kind of tell you what to pull out first. All right, so I don't really need this. Can y'all hear me okay?
They probably can't.
No, you probably.
Okay.
Thank you.
All right. So the first thing is, let me just touch on just 4 points, and then we'll get into some details. First of all, the proposal that we've put forth, we estimate that the minimum savings to the taxpayers is $80,000. That's the savings to the taxpayers. Now, the thought would be, well, yeah, if that's all you're going to do is save money, what about the benefits? Well, what we've done is we put together a proposal that matches the benefits that the state plan has. And of course, that's the plan that your employees have. In fact, what we've done is we've matched it to the point that we give it the same names that the state plan has. So the state plan has a well, first of all, are any of you guys in the state plan on the committee? Okay, so the state plan has the standard plan, the partnership plan, and the limited plan. Well, that's what we're calling our plans. We're using the same terms. So employees will be familiar with those terms, and the transition will be as easy as possible. All right. The benefits, the state plan standard benefit, is it going to be exactly like the standard plan? The state plan deductible for the standard plan is going to be the same deductible as our plan. So we've matched deductibles, we match co-pays, we match co-insurances. All right, and we're using the same name to make the transition as easy as possible. All right, and then I guess the last thing would be, one of the complaints that we've heard from a lot of governmental entities is the state is kind of hard to work with. You don't have a service representative really to speak to, and everybody's in Nashville, and nobody really comes to the county to meet with employees and that sort of thing. Executive Wallace has expressed, difficulty in just dealing with the state as far as enrollments and explaining benefits and that sort of thing. So what we're going to do is we're going to provide that one-on-one, that face-to-face level of service that you all aren't getting now. And I mean, I feel certain that that's going to be a big benefit as well. Okay? Now, let's go to the handout. All right, so the first handout should look like this. Okay? And you guys that have a staple copy, it's the last page. All right, so you start from the back. Everybody got that? We good? All right, so what that to the left is all the plans that the state offers now. All right, so you essentially have 9 options. You've got 3 standard plan options, you've got 3 partnership options, and you've got 3 limited options. Now the differences are the network. You've got Cigna has an open network, which basically is everybody. All the hospitals, all the doctors. You probably couldn't get out of network if you tried. Okay, that's the Cigna open network. The Cigna local network is a new network that they brought on board, and it's it's almost like an HMO in that it's a very limited number of doctors to go see. And then the Blue Cross network is their S network. All right, now just a kind of a general comment. With the S network, you're going to have all the doctors that just about every doctor can't really do business in Tennessee if they're not in the S network. But what you don't have with the S network is you don't have the the HCA hospital line. So you don't have, I don't believe you have the local hospital. You don't have Centennial, Southern Hills, Summit, Skyline. You don't have those hospitals in that Blue Cross network that the state plan has now, okay? All right? Now below that it shows your enrollments. It shows how many people are in the Cigna standard plan, how many are in the Blue Cross, the partnership Cigna, the partnership Blue Cross, and then the limited. You've got 3 people in the limited plan. The limited plan is a more high deductible, lower premium type plan. All right? Now the number below shows the total amount that the county is paying. Okay? It's not necessarily, that takes out the part that employees might pay for their family. Because I know that the county pays 100% of the employee's cost. So that just includes the employee cost. All right, then I added the cost that you pay now for the dental plan, again, employee only, and the cost that you pay for life insurance, employee only. Okay? And then there's the total. That's the county share for the fiscal year. That's the county, just of the county share. All right? Now on the right is what we're proposing. So instead of having 9 plans, we're proposing that you offer 3. Now if you'll notice, the Blue Cross plan that we're offering is Blue Cross's P network. And that's the only network we're offering, okay? Now, the great thing about Blue Cross's P network, as opposed to their S, which is in the state plan, is it's like Cigna's. It has everybody. It has a local hospital. I mean, it's just like Cigna. You'd have to try to get out of network in the P network. It basically, every doctor, every hospital, every chiropractor, you know, they're all pretty much going to be in the, and it's going to match what the Cigna plan network would be. Okay? Then we have a partnership plan, and then we have a limited plan. All right, now what we did was, this assumes a matching in enrollment. Okay, so this does not take into account if you all decide to make this change and employees change from the, you know, from the standard to the partnership, or from the partnership to the limit, or, you know, if there's some change in enrollment, you know, this, I can't possibly know that. So I had to basically, you know, stay with the current enrollment, and this is an apple, you know, apple for apple. All right, and so the medical piece of what I'm proposing, the county taxpayer part is $794,000 and change, and then I'm proposing a Blue Cross and Blue Shield dental plan. Now, what you all have now is you have 2 dental plans, and it's through the state. You have what's called a dental HMO through Assurant, and then you have a high-end plan. Who's the high-end plan with? Delta, yeah. You have a Delta high-end plan. So I could not, to be totally honest with you, like, not that I'm not normally not honest with you, but the Assurant HMO, the dental HMO is, it's almost not worth the paper it's written on. I hate to say that, but it's just not, and locally it's pretty useless. I think Executive Wallace said there's hardly anybody within, you know, 50 miles that uses it. And so what we've done is we've actually upgraded that minimum dental plan. The people that'll have the minimum dental plan that to match what you're doing now, where the county pays for it, are going to have a better plan than the Assurant plan. It's a Blue Cross plan, and it covers 100% for preventive, and it covers 50% for pretty much everything else. So it's a much better plan than the current baseline plan that Assurant has. All right. And then the buyout plan is pretty much like Delta. Now, it's a little bit more expensive. So you're saving money on medical, saving a lot of money on medical, but you're giving up, you know, you'd be giving up a little bit on the dental, because my dental options are going to cost a little bit more. But again, I would argue that the baseline dental plan is worth having. It's something that employees are going to like to have, as opposed to nothing against Assurant. I like Assurant, but that particular dental plan is, you know, it's not worth a whole lot. All right, and then the life premium, Right now, you're paying $875 per employee for $25,000 of life and accidental death and dismemberment. We're at $7 per employee, so you're picking up some savings there. So, bottom line, $825,000 versus $904, guaranteed savings of right at $80,000. Now, the reason I say 80, it's actually, the math works out to 79,421. The reason I know it'll be 80 is because the state plan renews in January, right? So if we do this plan July 1, you've got a state plan renewal, you know, for the second half of the year. And of course, it always goes up even if it's a small percentage. So it'll be at 80. All right? Now, that's a lot of information, I know. And I don't know how else to have simplified it, but let you all ask questions for a second before I move on. Or not.
Mr. O'Shea?
Can I?
Yes.
What is the cap? Has this got a cap on it, on your insurance, when you have,
I'm sorry.
on your top end? Is there a certain amount we can go over before we get penalized?
Well, here's how that's a good question. How do we do this? All right, here's how we did this, basically. Here's kind of the design. The state plan is what we call a fully insured plan. All right, so with the state plan, employees have their deductibles and their co-pays that they pay themselves. All right, and then the state picks up and pays everything above that. All right, here's what we did. I need both hands, so I need my other hands. So here's what we did. We're using Blue Cross and Blue Shield as the insurance carrier. And what we did was we raised the deductible of the Blue Cross plan all the way up to $5,000. Well, the out of pocket, we raised it all the way up to $6,000. All right, so your Blue Cross plan has a deductible of $6,000. Okay, that's one piece to the puzzle. All right, and that the premium for that is significantly lower than what you're paying with the state. All right, then we took that savings and we basically built down, if you will, to the plan that you've got now. And the way we built down is two ways. We created a self-insured, a partially self-insured plan where the county's actually going to pay for claims out of a sinking fund. All right, and then once the claims, but just to protect the county, give you kind of a safety net if the claims go crazy. We've got a stop loss. We bought stop loss insurance, and once your losses reach a certain cap, they stop. And then the stop loss carrier is Gerber Life. That's the insurance stop loss carrier. So that $80,000, that assumes that you pay out that. Well, first of all, that'll never happen. I mean, I can't guarantee it, but that assumes that you pay out of your account your cap, and you hit the stop loss. That's a worst case scenario, that $80,000. It could only get better from there, but we want to stay with the worst case scenario. So that's kind of how we built the plan. And so what we're doing is we're kind of taking, in a sense, we're taking the middleman out. You're taking the middleman out. You're going to pay a small portion of claims out of a sinking fund, and that way you don't have to pay insurance premiums, and that's how you're able to save $80,000. Does that make sense?
What's the penalty, though, if we do go over it?
Well, the $80,000, there is no penalty. The $80,000 assumes that you've hit your cap. You've paid out all that once you hit that assumes the highest amount that you would pay out of your partially self-funded part. And once you hit that cap, then Gerber Life picks up and covers everything from there. There is no penalty.
But there is a financial penalty from the Blue Cross premium if our claims go higher than what we've been averaging in the past.
Well, the $80,000 assumes the worst case for Blue Cross as well. All right. So the point is, there's two floating numbers, if you will. All right. Your own claims, and then the Blue Cross piece. But now, I'm not promoting, or I'm not even communicating that it could go down from there. I'm saying the worst case, if the highest Blue Cross premium and the highest payout of your claims would save you $80,000, guaranteed, for the 12 months.
So that would be a 12-month period or a calendar year or?
It goes from July 1 to June of 2014 to June 30th of 2015.
If we decide to go with this, how long will it take to implement if this has to come into effect the 1st of July? Is that even doable?
Absolutely. But we're going to have to get on it. You know, we're going to have to remove. But the second handout, I wanted to show. Now, I've not audited all these numbers. I'm pretty sure these are accurate. This is what we're going to use to enroll the plan. All right. Now, a lot of the information that Blue Cross and, by the way, let me back up. The organization that is administering the self-funded part is called Health Cost Solutions. Okay. My associate, Bo Mitchell, is in Mexico right now, so he couldn't be here. I wish he was here, but anyway, his organization, Health Cost Solutions, and I do several plans with them. They're terrific. They're going to be administering the self-funded part. All right, but in order to enroll it, because Blue Cross will let us do what's called a Excel spreadsheet enrollment. Most of the information that they need, you already have. You put it in an Excel spreadsheet, and we can merge it in to Blue Cross so that employees aren't going to have to fill out a long, detailed application. I mean, the basic stuff like name, address, date of birth, social security number, most of that. What we don't have from that, we'll have to ask, but everything else we'll be able to get. All right. And as far as picking the plan out, this is what we're going to use. This is what I've used in the past. It's a form that I create, and they just pick the plan they want, you know, and they print, sign, date, and they check the box of the one they want, and then and it just shows what if they want to cover if they're just going to cover themselves, they don't pay anything, right? Because the county pays for it. But if they want to cover their spouse, children, or full family, and this assumes 2 paychecks a month, 15, 30. So they know exactly what it would cost them out of their paycheck to enroll in that particular plan.
How about prescription? Is that mail order, or can you go to any local pharmacy?
You can go to any pharmacy. Yep. And there is a mail order for the maintenance drugs that are like a 3-month supply.
And also, since it's a new enrollment, any pre-existing condition, regardless of condition.
Covered. Absolutely covered.
Is there any required health coaching that they will have to participate in?
Good question. All right, so as you know, the partnership plan, we get, a lot of people complain about it. For the partnership plan, the premium's a little bit lower and the deductible's a little bit lower. So a lot of people like that, but they don't like the fact that they're 8 o'clock trying to have dinner or watch a little TV, and they get a call from somebody saying, have you been to see the doctor and got your checkup? Well, now this is your plan. All right, so you guys can do whatever you want to do. I mean, this is your plan. You're writing the rules. The state has built it. You're writing the rules. So the third handout is a sample of what we've done in the past as far as the partnership promise. Right? Everybody's got the third handout, right? Yeah, that right there. So basically, we're going on an honor system. Now again, this is what I'm suggesting, but it's your call. Is you go on an honor system. The employees just say, okay, if we'll take the lower premium and the lower deductible, and these are the things that we promise. And so we're not going to be calling them at night or doing anything like that. But we will know at the end of the year who got a physical, because we got the claims, right? Because we're paying the claims for the little stuff. So we're going to know who got a flu shot, who went to see their doctor and got the prostate exams and mammograms and all the wellness things that you're supposed to have. We're going to know that, and then you guys can decide when you renew next May. You can decide what you want to do. You could like we've had groups that said, all right, if you got the partnership plan, and you didn't do you signed the promise and you didn't do it, then you can't have the partnership plan the next time around. You got to go to the standard. But that's up to y'all.
Okay, so you would have to do a plan change, but there wouldn't be any involved penalty then?
No.
For them not doing that?
Nope.
Okay. Other question?
Yes, sir.
In the worst case scenario that we did meet the stop loss
Mhm.
cap 1 year, entirely the worst case scenario, if it happened the second year, what kind of rate increase would we look at?
Well, that's a good question. You know, your plan has two pieces.
Yes.
It has the partially self-funded piece, which is the smaller piece, and then the Blue Cross piece. So, you know, I don't, you know, probably the easiest to predict would be the self-funded part. Okay, so my guess is it would probably, the stop loss minimum would probably go up some. So that would probably go up a small amount. Now, Blue Cross, who in the world, I mean, there's no way to know. Now, again, I've not presented that, but it's possible that the savings could be a lot more than what I'm saying. I mean, I can't guarantee it, but it could be a lot more, depending on claims and from both Blue Cross and from your partially self-funded part.
So, one last question. If we were to look at 2 or 3 major medical claims, God forbid, from the employees,
Mm-hmm.
which we want the best care for them possible.
Yep.
If they were to have extended care at a health recovery facility for therapy, there's no maximum on it, is there?
There's no maximum on any policy in the United States now since the
Before they
Affordable
would be
Care Act.
discharged and have to go home and have their physical
The
therapy.
Affordable Care Act changed all plans in America. There's no limit.
Okay.
Mr.
On
Owens?
the plans here, the partnership plan, the standard and limited, I don't see any cost of out-of-pocket for what the dental is.
Well, I didn't, again, I can get that to you. I just wanted to, I can get that to you.
Okay.
I've got it
Well,
on
I just
that.
didn't see it here. I didn't know if that
Well-
is an extra cost, which it should be probably, but I don't know.
Well, the high-end dental plan is almost, in fact, it's identical to the current Delta.
Okay.
I mean, we tried to match it. But, you know, the high-end dental plan, the buy-up plan, if you will, is identical to Delta's. And I've got that. I just didn't want to just throw all this, you know, I was trying to.
Understand.
But I can get you very specifics about both dental plans. In fact, it's in my proposal, but I can get everybody a copy of that, the 2 dental plans.
Well, I just didn't see it, and I was
Yeah.
just wondering. So.
To follow up Mr. Dredden's question over there, he'd asked you about prescription and drugs, and you said maintenance, you could order or whatever,
Right.
mail order. What about far as the same prescription drugs versus what they're able to go get right now? Is that the same? Because
Well,
I know, when I'm asking, where I've worked before has changed plans. And, you know, we had a Blue Cross on a state plan, had prescriptions, you know,
Right.
105 pages thick. Okay, we changed, then it went to 3 pages. And my druggist said, you know, if you pay anything for that, you're wasting money, because, I mean, it's not worth it.
Yeah.
So that's why I'm looking at employee cost. Is it feasible to even be, you know, for family, to be paying anything if they're not going to get any prescription and or coverage from that?
Well,
Because it's hard to, you know, to go with a state plan covering everybody and a big, what he's talking about, far as sum of money going up in a year. And now, a year later, if we do go with you, you know, you're just looking at us. You can't spread it out against thousands of people.
right. Well, I'll use this now, because I don't need both hands. As far as the drugs go, we matched the copays. Okay, so.
No, not matching copay, that I seen.
Okay.
drug for drug? I mean, is these department heads and their employees gonna go from 100 pages of drugs to 2 pages? Are you gonna match drug for drug?
Well, if a drug is covered, if a drug is a covered drug now, it'll still be a covered drug. I mean, I've not run into any issue like that. Now, here's the only potential issue that we've run into because we've done several of these changes from the state plan. All right, we use Caremark as well, actually, no, it's not even an issue because we're using Blue Cross's. You know what? It's not even an issue. It'll be, if it's a drug, the way it's covered under the S network with the state, it'll be covered under the P network because it's still Blue Cross. So I don't think you're going to have an issue with drugs at all.
Well, I have seen that from the S network to the P network, then you would come in and say, well, now if you want to buy up to this, you can pay for it out of your pocket.
It'll be.
I don't want to see our employees do that. You know, if we're talking changes of that, I don't want to put our employees through what I have been through because you lost in the long run.
It'll be no different than the state plan now, as far as that goes.
What about 2 years from now?
Now,
using his scenario, worst case scenario.
well, every year the rate goes up. I really,
You said you could almost guarantee that $80,000 savings, but can you almost guarantee still that savings after 1 year?
no,
Okay,
I can't.
that's what.
Can't do it. I don't think, well, the state couldn't, nobody can guarantee that.
Right, but I mean, we know what we're getting with the state plan, that's what I'm saying. You're saying you can come in here and save us this X amount of dollars, but are you gonna be able to do that just with Humphreys County and not thousands of people?
Well, we can guarantee the 80,000 for the first year.
Right,
all right?
right.
The second year, if we're comparing it, it depends on what we're comparing to.
Right,
If
apples to apples or apples to
If we're
oranges?
comparing back to the plan that we just did,
Right.
it's gonna go up. That I can guarantee, all right? Now, but the state plan will go up too, so it's all relative.
Right.
If you'd have stayed with the state, that would.
It may have went up 3%, but are you thinking you're maybe going up 8% or 12%?
I don't know.
Right.
Mr. Wallace?
Mr. O'Shell.
If we
I
do,
guess.
go ahead.
No, that's,
If we're,
go ahead, Mr. Rochelle.
if we decide to opt out, and we don't get what we're thinking we're getting with this policy here, isn't there a 2-year window before we can reapply with the state to
Yep.
Yeah, it'll be 2 years.
2 years before we can go back with the insurance that we've got now, correct? Is that right?
That's correct.
Yeah.
You have to stay out of the state for 2 years.
Okay.
So, worst case scenario, you could go back into the state after 2 years. And so, my logical mind says if you save 80,000 or more the first year, and even if you broke even the second year, and then went back to the state, the taxpayer still save $80,000. So you know what I'm saying? I don't see a real downside, being that you only have to stay out for 2 years. Does that make sense?
Makes sense.
Commissioners.
You're saying you don't see a downside. You're
No.
not the secretary right here doing all this work, that are
Well,
may encumber some of it.
Well, I'm saying she's going to do less work because now you don't have a service representative with the state, and you're going to have a service representative. You're going to have myself and my staff. You're going to have Health Cost Solutions. My goal is part of this is to make it easier on the executive and his staff, not harder.
Okay. Mr. Chairman, have you presented this to any department heads, and have they seen it for us to ask what they think?
No, sir. I invited the department heads to this meeting for the purpose of interacting with you all and Mr. Herndon. We have discussed it briefly and to the limits of my understanding of the policy and its parameters. And to that point, been immersed in this health insurance question for several weeks now, and it's difficult. It's difficult because there is no apparent way to compare one policy to another. What we've got with the state now is a self-funded plan that they utilize Cigna and Blue Cross and Blue Shield to administer for them. My concerns have been echoed here tonight with the fact of what the potential impact is for having a small group and some catastrophic series of illnesses or injuries. I learned from Mr. Herndon and his business partner, Mr. Mitchell, that most of the costs associated with health care is in pharmaceuticals, prescriptions, and not in actual coverage. It's been an interesting learning experience for me, and I've been skeptical from the very beginning, and for a lot of reasons, not the least of which is what precipitated this was an offer, in fact, from Financial Blueprints to save us some money. But to immediately, before I would even entertain the notion that, I had to make sure that what we were getting was as good or better than what we have now. And sitting here before you, and after having spent hours and hours with Mr. Herndon and some of his peers who also want to provide the service, I feel like I'm better prepared to make an evaluation of that, but not 100% confident. Mr. Herndon's plan was by far the best one financially that was presented, and not only financially, but the fact that all the other plans presented to us were based on Blue Cross and Blue Shield underwriting, and specifically in that S plan. And the S plan is what we have now, and the difference is the network saturation. The Blue Cross and Blue Shield premium network provides as good a coverage as can be had in the state of Tennessee. So I'm comfortable that we're getting an upgrade in at least those people who have Blue Cross and Blue Shield today, and at least as good as those people who have Cigna today. He guarantees me that there's no possible way that we won't save $79,000 in the first year. I think it's highly unlikely that as a result of claims that our premiums will increase beyond that number the next year, and we can get back in the state plan in the year following. So it brings us to just a few concerns that I had, and I feel fairly confident that Mr. Herndon and his team are ready to meet those concerns. Getting out of the state plan is one that I have. We have a memorandum of understanding that says we give them 60 days. We don't have 60 days. Blue Cross and Blue Shield won't give you 60 days to decide to utilize one of their quotes. You can't wait that long. So he believes that we can get out of the state plan by July the 1st, and has guaranteed me that we won't have to pay double premiums in the case that doesn't happen. I had a little concern about the functionality of the health cost solutions piece of this plan offering. But he assures me that that's common in today's healthcare world, and that we wouldn't have any problem in utilizing a Blue Cross and Blue Shield card and a health cost solutions card in the same manner with identical coverages, mirrored coverages. I had concerns about the deductibles that our employees have paid to date, and he assures me that those will be grandfathered into the new plan. They won't have to meet that $450 or $800 deductible twice in the case of those who have unfortunately had to utilize health care at this point. There's a potential savings for the county, but there's also a potential savings for the employees, and as it relates to family and spousal coverage, the savings that we see will translate to them, and we don't have many taken. It's terribly expensive. Spousal coverage is about $720 a month right now for the very few employees that we have that have it now. The Affordable Care Act is going to mandate that everybody have health care, and I believe that exercising some of these options, that we may get some employees with family coverage where otherwise they couldn't afford it, at least through what we've been able to offer. End of the day, it's gonna be a pain in the neck to transition from the state plan to this plan. I have faith in what Mr. Hernan and his integrity and his ability to deliver what he says, and given those that faith and assuming that delivery, I believe we'll end up with a better plan after tomorrow. And that's a reluctant endorsement because I really didn't want to do this. Now he knows that. So there it is. In a few minutes, we're going to work through the rest of this agenda, and at the very end, there's a resolution which will authorize me to enter into a contract with Mr. Herndon's company, along with Health Cost Solutions and the underwriter of the stop loss plan, Gerber Life. And so do any of you county employees, at this time I'll open the floor to you all, department heads or county employees. There are not many of you here. I appreciate those that are. Got any questions? Got any concerns? Tell us to run backwards. Ms. Etheridge does.
Could anyone that's in the plan now become uninsured all of a sudden with you?
No.
Pre-existing?
Nope.
Anything?
Everything, if they're on a heart lung transplant list.
Cancer, whatever?
Yep. If they're actively ongoing treatment for anything, they're covered.
No one can be?
Nope.
Okay. Y'all can't make a determination? Okay.
Nope.
Your current company, 26 years, is that your current company right now? That's 26 years in business?
No, not my current company. Financial Blueprint, which is my company.
How long has that been in business?
Since 2008. I've just been in the insurance business. I've worked for other people. I've worked for myself since 2008. Yes, sir.
Do you have other counties that you're doing this with?
I do. You know, I don't mind, I probably need to just, I don't mind sharing that, not, you know, I can get that to you after the meeting.
I've spoken to, if I may interject, I've spoken to one county who has this very plan, had it for about a year. They're pleased with it. Saved them a lot of money in their employees.
That particular county, they've saved, now again, I'm comparing to this, back to the state plan, based on the enrollment they had before, apple to an apple, they've saved, it's a little bit bigger county than yours. And I can't guarantee this for y'all, but I can just tell you, they're close to $250,000. Now again, I can't promise that for y'all, but I'm just saying, that's where they're at.
Year to date.
Year to, yeah.
Is there a number, I'm very, not up on insurance, but the number that, where we break over from Blue Cross Blue Shield coverage to the self-insured part, what would that number be? Would that be $600,000 or?
No, I'll tell you what it is. That's a good question. Again, I've got all this information. I just didn't, but it's a lot of paper.
Mr. Chairman, was there not another hand? Somebody else asked a question before the commissioner started asking again.
It's $219,000.
How much?
$219,000.
At that point, we go on.
At that point, it's on Gerber. Gerber Life is paying all your claims over that. Of course, but here's on an individual basis, once an employee, you know, once a combination of what the employees paid out of their pocket and what their particular self-funded part hits $6,000, then it's on Blue Cross. I'm just saying that if you take all the people, you know, take all the self-funded part from everybody, once it hits $219,000, everything above that's on Gerber. That makes sense. Yes, ma'am.
Miss.
I don't smoke, but I'm gonna ask, does your company have anything to do with the the life part of smoking?
The rate's the same whether you smoke or not, for the life insurance. Yeah.
Ruth Ann.
What I want to ask about is like the dental.
Mm-hmm.
the state has their plan, which the county's paid for. I
Right.
pay the extra to go to who I want to go to.
Yep.
Where does that, is there a difference there with yours also?
It's about the same, the amount for you to buy up to it's about the same. It's within a dollar of what it was before. And you can go, it's the Blue Cross Dental. So,
See, it's a Delta Dental, and my dentist has a Delta Dental, but it's not the same as the state. So to be able to go to them, it's still Delta Dental, but I pay the extra.
yeah, well, it depends on whether your dentist is in the Blue Cross Dental network.
Okay. And you say we have more access on medical wise as far as hospitals?
What network, what plan do you have now in the medical plan?
The partnership.
Which network?
Blue Cross.
Yeah, you are gonna have more doctors that you can go to. If you're currently in Blue Cross, which over half of your group is in the Blue Cross and Blue Shield, that network is expanded greatly every year. So you're gonna be able to go to the local hospital, because the local hospital is a Centennial Trust.
Now, actually, they can utilize a local hospital in Waverly now, but
It's Dixon.
Dixon's.
Yeah, you'll be able to
Rising
go to
Medical
Dixon.
Center.
If you're in the Blue Cross network now, with this change, you'll be able to go to Dixon, it'll be in network, not out of network.
And same way with the doctors in that area because.
Yep, same way. So there's an expansion there. If you're in Cigna, if you're in the Cigna plan, you won't see any change.
William?
Have you had any problems with current billing and had to, going from one card to two and multiple people, and had to get a hospital say, well, you've got to pay for this now, and then you can fight to get repaid later? Only in years past, that's happened once.
Yeah, when anytime you change, as the executive mentioned, any change, there's so many moving parts to healthcare. I mean, it's just a bureaucratic, monstrosity. So yes, there is a potential for some provider, you're gonna have two cards now. I hadn't really got into that, but you've got two cards. And there is a potential, there may be a learning curve with the provider. But I mean, that's where we come in, we call the provider. I've had people call me in the doctor's office and say, hey, Tim, I'm here and I'm going to see my doctor and they're wanting to charge me, $1,000 and I've got a $450 deductible. And so, I get on the phone with the business office and tell them how this works. And it's easy to fix. We've never had any situation we couldn't fix. But there may, especially early on, there may be a few of those little hiccups. It's possible. I'm not going to sugarcoat that. Any change, we're just going to be with you to work it out. There's nothing that we can't fix. Okay? Yes.
You had invited the department heads here with us tonight, but I'm wondering, the school board being the largest probably employer in the county, have they given you any feedback whether
They're not included in this.
They're not included?
No, sir.
We'd love to include them though if they'd like to. Anybody?
Why would they not be
The
included?
state offers education employees a different plan than what they offer general employees. They've got a better deal than we have.
Okay.
Mr. Carter?
First of all, I'd like to ask y'all, the commissioners, before you make this decision, take into consideration, anytime you change insurance, if you're not using insurance, you're doing good. You don't have that problem. But if you're on an insurance using regular basis, like a lot of us are, when you go to doctors and you have to change all this, when you're going like we are with the partners now, it's every 3 months, stuff like that, it's gonna be a changeover period, it's gonna be aggravating to everybody. And y'all are saying if it don't work out, you go back. Every time you change insurance, you've got that period, you gotta go right back through. Really have problems getting all your insurance providers swapped over every time you go. So all I'm doing, I know y'all are looking at it 2 ways. Thank you for looking at it 2 ways. One, you're trying to save our tax dollars, but take into consideration, you're gonna put the employees in a small group. Right now, this large group, a whole lot of these problems have been taken care of for you as a county and employees. Not knocking your insurance, because I don't knock it that way, but like I say, right now, the bargaining chip is a large statewide fee. This network you have, you know, it's well accepted all over everywhere, and you're gonna go through a transition process. If you're a regular user on the insurance, it's really gonna be aggravating. So I just ask you to consider all that before you look at the dollar amount. Thank you.
Who else?
Are you on it?
Mr. Hooper.
Well, you're gonna have it should, as far as the network goes, you're in the Blue Cross, you're in the S network. You should not have any trouble with the network piece of it at all. So, I mean, if you're worried about that, that's not gonna be a problem. Now, as far as the learning curve with using two cards, that could, but only on the front end, but you're not gonna have any network problems, I promise you.
What I'm looking at is we have changed insurance before here over the years, and just like I said a while ago, getting everything swapped over. Like you said a while ago, it's gonna take some time to swap over from the state network to your network. And the people that's using insurance is gonna go through some problems getting it swapped over, and nothing they can do to help that. Like I said, if you're going regular to doctors and all, to get the card swapped over, there's gonna be a time there, it's really gonna be rough to get doctors paid, because you're gonna have swap over one company to the other company. There's gonna be a period that you can't file at one place, you can't file at another. Always.
Well, again, I don't think that'll be a problem, because still, it's still Blue Cross's P network. Now you've got Blue Cross's S network. So it's still Blue Cross. So the network piece of it's not, but yeah, there could be a hiccup or two about the providers. And I don't disagree with that. But you know what? We're gonna do our best to make it as smooth as possible. And we've done these transitions before. We have not had, I mean, we've had a few little hiccups, but they've been very small.
Mr. Hooper.
Mr. Wallace, do you know what our average payout has been for the last 2 years?
Claims history? No, sir.
It's 219, is it? Got hung up on it, I don't know.
That 219 is the piece that we're self-insuring, which is basically the difference in the deductible and the out-of-pocket between what they're paying now and what they'll be on paper paying in the future with Blue Cross and Blue Shield. So, you know, that to relate that to what the actual claims could be, that's potentially just a fraction of what that number is.
That was the number I was looking for
Yeah.
to start with.
I have no idea.
Can I address that?
Yes, sir.
You know, we had to get the claims from the state in order to quote for the Blue Cross piece. We had to get the state claims, and your claims are terrific for a group this size and for a governmental entity. You all have. Now again, I don't know about the past. I'm just talking about the last 12 months of your claims are better than any governmental entity that I've seen of late. And here's another thing about your claims. The state plan has 3-tier rates. Okay, they have an upper tier, a middle, and a low. And your premiums are based on what tier they put you in. Well, y'all are the only county that I've involved in quoting that's in the low tier. So that tells me, you know, my logical brain is that your claims are really good the last 12 months. And my thought is your claims have probably been pretty good going back even further, because you've been with the state since, like, what, 1994 or something? Not 92, or you've been with the state a long time. So I suspect your claims as a group are pretty good. And so that is the kind of situation where this can be a better fit. If, you know, because you get to keep the state. See, now if you save money on claims, you're just sending the money up to the state. I mean, there's at least this way, if you save money on claims, you get to keep it. And you get to use it, you know, for for future increases or whatever. So my gut is that your claims are gonna be pretty good. I can't guarantee it, but just based on the last 12 months and the fact that you're in that lower tier, which I'm sure that's based on a history with this group, not just 1 year. Is that?
One other question. So the standard plan, this 5,000 full deductible plan for a family coverage right now, $484 twice a month for the employee and a family. Correct?
With this new plan?
Yeah, right here on this page.
Yes.
What are they paying now? I thought I heard of 700 and stuff.
No, they're paying just shy of 1,400
Versus the,
for a full family plan with spouse and children.
so they're gonna save $600.
No. Mm.
Well, what that number, sir, takes out the piece that you're already paying for the employee. I just calculated the difference.
Yeah, they're gonna save a couple $100.
Yeah, it's
$182 or $3
Per payday or per month?
per month.
Now, one of the things that we threw out there, and this is up to y'all. Is it okay if I mention this about the limited? All right, so, all right, you only have, the limited plan, the premium's quite a bit less. Now, the deductible's higher, all right, but the premium's less. So you've actually got, so the county will pay 100% of the employee's part, whatever plan that you buy, okay? Well, you got three people that took the limited plan, all right? So I threw it out, and this is up to y'all, but I threw it out to Executive Wallace. If you're gonna pay for whatever plan, if an employee wanted to choose the limited plan, that means the county was paying less. I said, what about this? What about if the county took the partnership premium, which is the middle premium, and paid that toward the limited plan? And then that employee could take that money, because it's the same for everybody, and use it to cover family or spouse or kids. So you can basically, even the limited plan's a lot less, but if the county's going to pay the same, if the employee chooses to take the limited plan over the partnership, then that extra money they could use to apply toward spouse and or family coverage. And it's not costing the county anymore because they're paying the same amount for everybody. So that's why if you look at on the far right, you may have some folks that would opt to do that. I don't know if I explained that very well.
Mr. Wagner?
I was just going to ask one question, Mr. Turner. During your time when you were transitioning with these other counties or anyone else, you've never had any issue with anyone being denied service or?
Never.
Okay.
Never had. The only, like I said, the only thing, and this only happens like the first few weeks, is and it's a provider. It's not Blue Cross's fault. It's not Health Cost Solutions' fault. It's not your committee's fault or my. It's basically the provider doesn't want it. The provider has to file it with both plans for it to work, and sometimes they don't do it. And so we have to call them up, or we have to communicate. Now, during the enrollment of this new plan, we stress, and I feel like we do a pretty good job of it, of educating employees. Look, you got two cards. You give them both, and if they say we're only going to file with one, say no. If you want your money, you need to file with both. I mean, you almost have to, Now, hopefully, that'll be very few times, but you have to insist on filing with both for it to work right. Is that?
Anybody else? Thank you, Mr. Hernan. Appreciate the job you've done here. Moving on, so while still in committee, talk about some budget concerns. The 2014-2015 budget, gone through workshop and additional address in last budget committee meeting. There has been a considerable discussion about a request that may have been misidentified as a charitable, that was misidentified as a charitable donation to light a softball field in McEwen. And Commissioner Hooper volunteered to gather some information, set it straight. I know Mr. Westbrook's in the audience. Mr. Hooper, what do you like to share about that?
Well, we found out that the ball field in question was the high school field. And back a few years ago, Jamie Long actually started the field. He got all the dirt work and stuff donated. I can't really remember what contractor, I don't know if it was Vaughn or who it was. They came up there and worked on it. Over the years, my girls played there. We planted the field, we sowed the field, we built the dugouts, raised all the money. And only money that I'm aware of that's ever been spent at that ball field, other than what several of us have raised over the years, was Mr. Long gave us $10,000 for the fencing and the backstop. We actually got the poles from Inland Container that makes the backstop. They donated all that, and we welded them in place and carried that up. It was a community-wide effort to build that field, and lighting has been ongoing, trying to get that stuff. And I know Mr. Westbrook's has some of the lighting that we collected years ago from the football field. And we can't hold certain tournaments and stuff. We always have to travel and go somewhere when it comes our time to do the tournaments, which is another loss of income for our school. I'm in support of the donation, and I'm sure Mr. Westbrook would like to expound on it.
Mr. Westbrooks?
Only thing I've really got is that, like I said, there's not been any money spent from the county on the facility, and putting up lights is not a cheap thing. I've got the old football field lights that I've got in my shop right now. Matter of fact, I've got a 24-foot gooseneck trailer full of lights that I've got to see if I can get 24 of them to work. The wiring, I haven't been able to get a hold of, I guess, the right people that do our TVA yet. I'm trying to get everything donated, but there's poles. I've got some old friends from I work with TVA. They were supposed to come across. So far, nothing there. Poles are somewhat in the vicinity of $750, $850 each. The lights, I mean, the last Dixie League field they lit up was $18,000 just for the poles, the lights, and the wire. And what I understand, since it's going, all this is going to be a kind of a capital project going through the school system. It's the only way I think you can do it, saying that everything's going to stay on county property. That now we have no problem working with the county or the school board or whichever way that is deemed necessary, and it will be only charged on items that will be brought in and established there that will not be moved. Things like a safety rim around the outside fence. We don't have a safety rim. We've already had a couple injuries when a girl reaches up and the chain link fence grabs a hold of it. That's just items like that. Lighting is the main thing, but that we wanted to try to see if we could put in a concession stand. I've already made a question to see if I can get some blocks donated. It comes down to anything that we do not spend, y'all are going to get back. I mean, I know y'all don't ever hear that because I've sat in your seat before. Usually when you give out money, you know there's going to be a zero figure when at the end of the time. But I've, like I said, I worked with TVA already on the line crew. They were supposed to be here this month. I talked to the man just 2 days ago. He tells me it's going to be August or September because they kept their people so short. That if I can get wire and stuff from TVA, and hopefully I have enough lights. If we don't, we'll have to buy a certain amount of lights. And we want to try to build a concession stand. Within the concession stand, there's a bathroom because there's not a bathroom in the area. You have to go to the front of the gymnasium, 300 feet, 400 feet away to go to the nearest bathroom. As soon as the girls' team show up, the first place they hit. And you know how that is. And we're just trying to make the facility where we are hosting the district tournaments this year, we're supposed to. And to do that, we need to have the lights and we need to have restroom facilities. And like I said, if we spend $2,000, you get the rest back. If we spend $8,000, you get the rest back. And it's not going to be spent on items like chalk material or dirt or anything. Well, dirt we could actually, it stays there, so I guess you could do that. But any type of fill mix brought in. But anything that is be spent money on will be on county property and will not leave county property. And I know somebody said they all had some questions. Is there?
Have you talked with Mr. Long about this, and is he agreeable to?
I haven't seen Jimmy. I haven't seen him since I talked to him about trying to get a parking lot fixed, and he did. I see he took care of that real good. We got an extra parking lot out there, but we had some problems with the teams coming in before school got out and parking and blocking all the teachers in. And I asked him about the other parking facility. They were real nice about getting on that, got that done. So that's another one of our headaches gone. I mean, I've been doing the mowing on the field. I do all the trimming. I even brought my tractor out and bush hogged outside the areas and stuff just to make the place look better. Sage grass was this tall, just 10 feet outside the fence. And we just want a place to look nice with the proper stuff for the girls to play on.
But this is the school's ballpark, correct?
This is the school's ballpark.
The lights that you have taken down from the football field, why were they taken down, and are they usable for this facility?
Well,
I mean, if they weren't good enough for football field, why would they be good enough for softball field?
That I don't know why they actually took them down. They put up new poles, new lights, everything out there. You know, in this area here, football rules over all other sports in school. And somebody got enough money to put them up. They put them up. The old ones were moved out. They, like I said, I don't know how many I'm going to be able to fix. If I have to buy a few, we'll have to buy a few. The wiring is, cost of copper these days. To run like a number 2 cable around the fence, all the way around the fence. I'm going to try to put everything in ground if possible. I don't want stuff above ground if there's any way possible. And it's a little bit more expensive, but it's a whole lot safer and a whole lot better. Something you don't have to worry with again.
Who's going to pay the electric bill?
Well, that's one part I did talk to Jimmy about. They talked about tapping onto the one of the county transformers already there. I haven't talked to Meriwether Lewis yet, but Jimmy's the one that made the suggestion on that. And for the ball games, most of them start early enough that by just the last inning or two, and a junior varsity game, we can't even play a junior varsity game in the early part of the season. We're the only school, well, this last year, us and Clarksville Academy were the only schools in the district that didn't have lights on the girls' fields. Their posts and lights were sitting right beside their field. They just didn't get them put up in time. They may be up by now, I don't know. We'll be the only school in the district without a lit field.
So what is your plan from here forward? I mean, what is your next step?
First is I've got to get I'll be repairing lights. So as soon as I get out of the hayfield, I'll be repairing lights all the way up until the poles get here. I've got the North American Lineman Training Academy. It's right outside of McEwen. Gary's a friend of mine. He's already told me they'll set the poles for us, so that's with no cost there. And if I can get the poles donated, there'll be no cost there. I mean, it could turn out to be I don't need but just a few $1,000s, but yet it could be that I could need up to $10,000, because I don't know how much of the wiring to get paid for. Copper, like I said, copper wiring is expensive as could be. You could almost eat up $5,000 or $6,000 in copper wiring alone. Run number 6 or 8 up the poles and a number 2 wire around 3 conductor. You're gonna take up some wire. Approximately 1,000 foot of I say probably be number 2, could get by with 4, and probably at least 4 poles, 250 feet of number 6 or 8. So you're still talking a large amount of money wide. That's one of the most expensive parts of it. I'm hoping to get a lot more donated. I'm hoping to come across with, since DuPont's had this construction down here with a new plant and TVA, I've already contacted some old friends at Cumberland City to see what I can do there. I haven't with it at New Johnsonville, but some of the people at New Johnsonville told me they've pretty well cleaned most of their excess stuff out, and it's been moved to Cumberland City. So I don't see anything there, but I'm hoping with DuPont with the new construction, they may have some spools of wire that we might be able to use and get from them. See if we can get it donated. But see, I'm coming in front of y'all begging for money. I've been begging for the last 2 months trying to get stuff done. A lot of the parents, and even myself, my daughter was started as a coach this year. I don't know how much I spent out of my pocket. I sat there, keep the field drug, keep it mowed, everything else, all season long, just trying to keep them from having to spend any money because there wasn't much money in the fund when they started. And so all I'm doing is just, like I said, the old, excuse me, but when I was on the county court, there was some groups that came every single year for a donation. To me, that should have been put in a budget if they're gonna come every year. A donation is a one-time thing. You won't see me back. But, I mean, is there any questions about, I'm trying to explain what all we want to do, and everything, well, like I said, will be built, will be there, and will not move off the property. If we need to go through a capital project, I don't know how you would work.
See, that's the thing. This is on school property. That request, all that money, if a funding mechanism comes from this body, it'll have to be funneled through the school board. That's school property. It's insured by the school. It's managed by the school. So in order to add that money to their budget, that request is going to have to come from the school board.
Under a capital project?
Well, it'd be under their capital. It'd be under a capital project for them if.
See, I don't know. When I was on the county court, all capital projects was run through the court, not through the school department. If anything was built on the school, the capital project came through the court.
Well, I can check on that, but I just feel like that they're probably going to want to funnel that through the school system, through the school budget as a capital project, just like these school building programs and everything else. Now, I guess the first question is, to what extent is the commission inclined to support this? We can worry about the mechanics of it after that's been determined.
What are the age groups of the girls that are playing?
This is the high school team, it's freshmen through seniors. It's 14 through, I guess some of them are as old as, might be as old as 18 by the time they graduate.
Do you have a booster club? Or?
Well, yes, ma'am, we do. That's what I'm here as, a member of the booster club. But our booster club is not too awful big in size. I mean, we've, over this last year, some of our leadership for the booster club, their kids graduated last year, and it kind of fell back a little bit this year. That's why right now every sport is pretty well dependent on, fighting for themselves about building, and any type of things they want to do, they have to raise their own money for it. The Booster Club comes across with something. We do sell concession stands at football, both football and basketball. But that's split between baseball, softball, boys and girls basketball, football, track. I mean, there's 15, 20 different groups.
Mr. Webster, I really appreciate all the work that you do. I can certainly relate to it. I was wondering, have you contacted the city of McEwen and maybe Meriwether Lewis, Waverly, and Centerville?
See, again, with city of McEwen, you get where it's county property and not city property, and if that comes across with a little bit of a problem there too.
Yeah, but for a donation.
Oh, no, I haven't asked them for a donation. No, not cash donation from them. No, not yet. As far as Meriwether Lewis, had some friends that are linemen, and I'm an electrician myself, and I made a call to some lineman friends, and that's where I'm hoping to get the poles from. Like I said, the cost, and I don't know, Larry probably know, I don't know whether Meriwether Lewis donates poles or not. I don't even know. So And the ones that will be, that I get from TVA will be used ones. And there'll be big ones that'll have to be cut back and stuff, take what was in the ground before, cut back and made a little smaller. I mean, it'll be guys out there with chainsaws and stuff, and we'll, with the help of the Lineman Training Academy, we'll get them set.
Mr. Hooper.
I can't tell you that a few years ago, when my daughters were playing, we were trying to light this field, that Meriwether Lewis would not donate the poles or the labor itself.
The Lineman Training Academy, I used to lease the property that where he lives and stuff for a farm, cut hay off of. So I've known Gary for probably, gosh, 20 years. And when our kids were little and played ball together. So Gary said he would set them with no problem. They've got their dig trucks, they've got their pole trucks to set everything with. He's going to use it as part of his classroom work. They're going to come out and do it as part of their classroom work. Like I said, I'm trying to get everything I possibly can donated and all. I've even made a phone call to the National Sounds trying to get folding chairs things donated. And they said, we would love to, but this park belongs to the city, not to us. So, I mean, everything I can come across the old mind is written down and said, let's make a phone call. And like I said, I've sat in y'all's chair before, and I know money, everybody's always asking. But this is one thing, if it goes under the property, it's going to be county property, it's going to be there from now on out. If anything that's not going to be, this money's not going to be spent for, and will be returned, I guess, next July when the budget ends. It'll go back into the budget again.
I'm sorry I'm naive, but I just don't understand why, if this is a school project, why it hasn't been handled by the school. I mean, something I'm missing here. Maybe you guys know and I don't.
As far as trying to get something out of the school department, that's not easy to do either. But their money is pretty well, you know, for any type of extracurricular activities, the school money is.
Well, didn't you say this would bring in money?
Well, it'll bring in some money.
I mean, if a businessman
A
wants to bring in money,
softball or baseball game, the money they bring in, hopefully will pay for the umpires. At $75 a ball game per umpire. So it's softball, baseball is more or less a non-profit sport. Matter of fact, you'd be surprised by how basketball travels. It's a barely break-even sport. Football is probably the only one that makes money.
Any more questions, comments?
Mr. Chairman, I just got one. I know, unlike Mr. Hooper, my kids played with his, and we've been trying to get that field lit for several years. And just to have a tournament, so they could have a tournament themselves instead of going everywhere outside the county. Have other counties come to us, and that's what they're trying to do.
This last year, because of not having lights, I don't think we had but 7 home games. Because everybody wanted to do a junior varsity game, and we can't do a junior varsity game because it gets dark before we had a high school game, the last one of the season, so you know it's up into the year. It went into 9th or 10th inning. They had to go what they call international rules. They put the first batter, automatically goes to second base. It was already dark. The umpires were wanting to call it, but it was National Christian. We're 50 miles apart. Nobody want to make the drive again. Sometimes it's to the point of we got to do something or start having daytime ball games and let the kids leave school in the middle of the day, and that's not good for the kids.
Anything else? All right, I'm going to ask for a consensus on this item as it relates to the possible addition of $10,000 to as a capital project. I'll find out the right place to put it from the auditor. I'm going to ask for a consensus, and I'm going to ask Ms. Etheridge to give us a roll. Yes, if you're for adding it to the budget. No, if you're not.
Mr. Chairman, is it not already in the budget?
No, sir.
It is not?
No, sir. The budget's not adopted until
Okay.
the 23rd of this month.
But actually, but it was, we did discuss that at workshop, and it was in the preliminary budget.
It was we had in the budget and after the workshop in the charitable donations. But that has been removed and was removed at the time of the last budget meeting.
Who removed it?
I did.
I told you to remove it.
I removed it because it was inappropriately assigned to the charitable donations. So that's the reason we're discussing it now, Mr. Daniel.
Yes, sir.
Mr. Wallace, regardless, it's gonna have to go through the school system.
Not necessarily. I don't know that. I'll find
But
out.
you're gonna find out.
Yeah.
It used to be all capital projects had to come through the court.
I think technically we could actually add it to capital projects, either in the capital projects fund or in the general fund, but, I don't know, Mr. Mayberry?
Well, wouldn't we ultimately need at least the consensus of the school board or the director of schools? Because ultimately, they're gonna be paying maintenance, and I don't care what transformer it comes off of, somebody's gonna be paying an electric bill. And who, so I just really think we need,
Jimmy's the one that suggested that technically they would get Meriwether Lewis to tap off of one of their facilities already there, so they wouldn't have another meter, which would cost them more money.
but, you know, those kilowatts are still gonna be coming through that transformer and through somebody's meter. And, you know, and somebody's gonna be paying the electric bill.
Well, that's why I said Jimmy suggested it,
Right,
so
okay. So-
he accepted
and-
the problem of the extra. But you're talking 10 games, and only the last certain portion of them, plus the junior varsity games would be the ones that were to be lit.
I'm fine with that, but I just want it to be a project of the school, and I think that comes under the director of schools and the school board. And I would vote to fund it under those circumstances. You don't want that right now, but that's just.
I understand that there are a lot of parameters that need to be defined and some issues to be worked out, but ultimately, it all depends on the funding. Certainly, distribution of those funds could be dependent upon those issues being worked out.
In regard to funds, Mr. Chairman, excuse me, I'd like to know what I'm funding. I'd like to know exactly what I'm funding, and not have an open checkbook when I start funding something. And that's what we're doing right now, and it kind of bothers me a little bit to write a check and say we're gonna get something back.
Under capital.
That doesn't ever happen, so.
Under capital projects,
I'm like Larry.
you can only spend the money on a facility or an item that is being placed on the county property.
But we don't know how much. You don't know how much.
No, because I'm hoping for donations and I'm trying to cut it back, because I know.
Yeah. I understand that, and I do appreciate that in what you're doing, but still, it's an open subject. We have no idea what it's gonna cost us.
Well, the question before the committee is to include it in the budget at this time. Now, I like a consensus and one that I could incorporate into the budget one way or the other and bring back for adoption when we meet in special session on the 23rd of this month. Any action after the fact can be determined at any time. Qualification for utilization of the money can also be determined. But we're it's one of those things where if we're going to include it in the budget as presented and adopted and sent to the comptroller for ultimate approval, we need to decide tonight. And it's with that, if there are no other concerns, comments, or questions, I'll ask Ms. Etheridge to read the roll. Everybody okay with that? Ms. Etheridge.
Mr. Coleman?
Yes, ma'am.
Mr. Daniel?
Yes, ma'am.
Mr. Dredden?
Yes.
Mr. Graham?
No, ma'am.
Mr. Hall? Ms. Hampton?
No.
I'm sorry, what?
No.
Mr. Hooper?
Yes.
Mr. Hughes?
No.
Mr. Hunt?
Yes.
Mr. Hurt?
Yes.
Mr. Mayberry?
Yes.
Mr. Rochelle?
No.
Ms. Spencer?
Yes.
Mr. Wagner?
No.
Motion carried.
I'll add that to the budget. All right. One more thing.
Can I say something first? I appreciate David coming, and thank you, Mr. Hooper, for arranging that, and for you coming and answering questions.
If there's any more questions, feel free to call, and that stuff, anything I can.
Thank you.
Okay. With the addition of this $10,000 in the capital projects, it's the only change on the floor right now to the budget that's been presented to you tonight. I plan to correct the budget to reflect this additional money and present the proposed budget for publication to the News Democrat tomorrow for publication on Friday, and to adopt on the 23rd of June. This includes everything that's been discussed, everything that's been approved up to this point, as well as the cost of the additional funding necessary to complete the jail project, specifically the door locking mechanisms, installation of a new control panel for operation of the new doors and the modified doors within that facility in compliance with the fire marshal. Total cost on that, $66,111. We have some contingency monies that are built into that project, and hopefully we can utilize. They won't be used prior to at the conclusion of the project, and we can deduct from that in the amount of about $33,000. But I'd like to add it to this budget, and without objection, I will. All right, with no other committee business, and without objection, I'll declare the committee a whole adjourned and report the proceedings and resume the meeting of the full board. Next item on the agenda is resolutions. $15,000 aviation fuel purchase. This expenditure will be offset by fuel sales and should see us through to the end of the year.
Make that motion, sir.
Motion, Mr. Graham.
Second.
Second, Ms. Spencer. Any discussion? Ms. Etheridge.
Mr. Coleman?
Yes, ma'am.
Mr. Daniel?
Yes, ma'am.
Mr. Dredden?
Yes.
Mr. Graham?
Yes, ma'am.
Ms. Hampton?
Yes.
Mr. Hooper?
Yes.
Mr. Hughes?
Yes.
Mr. Hunt?
Yes.
Mr. Hart?
Yes.
Mr. Mayberry?
Yes.
Mr. Rochelle?
Yes.
Ms. Spencer?
Yes.
Mr. Wagner?
Yes.
Motion carried.
Next item, Humphreys County Library Board reappoints Mr. Hughes, Ronald Hughes, to the board with term ending June 30, 2017.
Motion, Mr. Chairman.
Motion, Mr. Coleman. Second, Mr. Hooper. Discussion. All in favor say aye. Aye. Opposed? Red Rivers Regional Library Board reappoints Ms. Nelda Durham to a term on that board ending in June 30, 2017. Motion,
Mr. Chairman.
Motion, Mr. Daniel. Second, Mr. Wagner. Mr. Daniel.
Daniel, sorry.
Mr. Wagner, second.
Mr. Wagner.
Discussion. All those in favor say aye.
Aye.
Opposed? Motion carries. Next item, American Gold Star Mothers Resolution approves memorializing Tennessee State Route 1, Highway 70 through Humphreys County as Gold Star Families Memorial Highway, honoring our fallen heroes. This carries an expense of $325.
So moved.
Motion, Mr. Hughes, second, Mr. Dredden. Discussion.
That's just for the signs, is it not, Mr. Chairman?
Yes, sir. Two, one on each end. Ms. Etheridge, at your convenience.
Mr. Coleman?
Yes, ma'am.
Mr. Daniel?
Yes, ma'am.
Mr. Dredden?
Yes.
Mr. Graham?
Yes.
Ms. Hampton?
Yes.
Mr. Hooper?
Yes.
Mr. Hughes?
Yes.
Mr. Hunt?
Yes.
Mr. Hurt?
Yes.
Mr. Mayberry?
Yes.
Mr. Rochelle?
Yes.
Ms. Spencer?
Yes.
Mr. Wagner?
Yes.
Motion carried.
Next item, Buffalo Convenience Center authorizes me to negotiate terms for a new or amended lease with Mr. Dennis Jones for the utilization of the convenience center located on Old Highway 13 in the Buffalo community. Carries a $800 a month annual, $800 a year, $1,800 a year.
A year.
Yeah,
Annual.
1,800.
or a year, either one, or both.
All 12 months.
Any motion on that?
Yeah.
So moved.
Have a motion, Mr. Rochelle, second, Ms. Hampton. Concerns, questions, clarifications? $1,800 a year.
Yeah. Mr. Coleman?
Yes, ma'am.
Mr. Daniel?
Yes, ma'am.
Mr. Dredden?
Yes.
Mr. Graham?
Yes.
Ms. Hampton?
Yes.
Mr. Hooper?
Yes.
Mr. Hughes?
Yes.
Mr. Hunt?
Yes.
Mr. Hurt?
Yes.
Mr. Mayberry?
Yes.
Mr. Rochelle?
Yes.
Ms. Spencer?
Yes.
Mr. Wagner?
Yes.
Motion carried.
Next item, the emergency communications radio purchase authorized me to enter into agreement with the Humphreys County Emergency Communications Board for a cost share repayment of necessary to facilitate a radio change to comply with new FCC mandates.
So moved.
Motion, Mr. Hughes.
Second.
Second, Mr. Mayberry. Discussion. Money's built into the budget that's been proposed.
Mr. Coleman?
Yes, ma'am.
Mr. Daniel?
Yes, ma'am.
Mr. Dredden?
Yes.
Mr. Graham?
Yes.
Ms. Hampton?
Yes.
Mr. Hooper?
Yes.
Mr. Hughes?
Yes.
Mr. Hunt?
Yes.
Mr. Hurt?
Yes.
Mr. Mayberry?
Yes.
Mr. Rochelle?
Yes.
Ms. Spencer?
Yes.
Mr. Wagner?
Yes.
Motion carried.
Next item, Highway Department bid acceptance. Action accepts submissions from various vendors for the supply of regular maintenance materials utilized by the Humphreys County Highway System, recommended by Mr. Wood and the Public Works and Safety Committee.
So moved, Mr. Chairman.
I have a motion, Ms. Hampton, second, Mr. Daniel. Discussion. All in favor say aye.
Aye.
Opposed? All right, next item, financial blueprint, employee insurance, resolution authorizes me to enter into an agreement on behalf of the county, general, sanitation, highway, and drug enforcement departments with Financial Blueprints of Nashville for brokerage of continuous health, dental, and life insurance coverage.
So moved, Mr. Chairman.
Have a motion, Mr. Wagner. Who was it?
Mr. Hunt.
Second by Mr. Hunt. Discussion. Roll call, Ms. Etheridge.
Mr. Coleman?
Yes, ma'am.
Mr. Daniel?
Yes, ma'am.
Mr. Dredden?
Yes.
Mr. Graham?
Yes, ma'am.
Ms. Hampton?
Yes.
Mr. Hooper?
Yes.
Mr. Hughes?
Yes.
Mr. Hunt?
Yes.
Mr. Hurt?
Yes.
Mr. Mayberry?
Yes.
Mr. Rochelle?
Yes.
Ms. Spencer?
Yes.
Mr. Wagner?
Yes.
Motion carried.
Next item, notaries, public.
For new notary this month, I have Vicki K. Ellis. For renewals, I have Tanya K. Lambright and Janet D. McGrew. The money and the paperwork is in my office in order, my recommendation.
So moved, and Mr. Etheridge's recommendation.
Motion, Mr. Daniel. Second, Mr. Coleman. Discussion. All those in favor say aye. Aye. Opposed? Other business, commissioners. Hearing none, I'll entertain a motion.
Motion to adjourn, Mr. Chairman.
Motion, Mr. Daniel, second, Mr. Hunt. All in favor say aye. Aye. Thank you.
Thank you, sir.